Welcome to episode 4 of our Navigating the Transformation of the Quality Measurement Landscape. In this episode, we're going to discuss performance measures both from a calculation and a validation perspective. I'm joined by Maria Badani to discuss digital quality measures and interoperability in the context of performance measurement and validation. As always, please comment, share, and like on social media, and please reach out to us directly for further conversations. So Maria, you have been in the trenches when it comes to healthcare quality performance measures and the associated validation process. Why do you feel like this topic must be discussed in the context of digital quality measures and interoperability?
Thanks, Reid. It's good to be here again with you. So far, you and Michael and Monica have covered all of the big concepts, but I put myself in the shoes of a quality director or other quality staff at a health plan, and I think, what does any of this have to do with me? And let me know when it's going to impact me or make my life better. I'd like to tie a discussion back as to how this impacts quality measure calculation and reporting, and then the validation of those metrics. As we move towards digital quality measures, the basic needs don't change. You must have reliable data sources, clear specifications, and effective mechanisms to validate the results internally and externally.
Yeah, I mean, I can't agree more. So walk me through what will change as we go through this transformation.
So when NCQA introduced the ECDS measures, I'm going to use an example, depression screening and follow-up. It was really hard for the health plans to identify appropriate sources of data that would help with the reporting of this measure. This measure was really complicated. It had 2 denominators, 2 numerators, and the additional complication was that the measure required codes that are not necessarily reimbursable. And providers are only going to bill codes that are reimbursable when they send in a claim. So there was a disconnect between the information available on the claim for making a payment versus what the health plan needed to be able to report this information. Now, this does not imply that the member was not receiving care. However, the rule of quality measurement is if you cannot measure it, you cannot improve it. So there was an immediate concern and a recognition of the fact that various systems that house the data do not talk to each other. And that is the idea of interoperability, and that will change for the better.
Okay, so how do you see digital quality measures fitting in?
So that's a good question. Digital quality measures are a natural progression of building on measurement processes. So DQMs are going to address the issues with traditional measures, such as interpretation of the specifications and other concerns that are inherent with traditional quality measures. So DQMs will draw data needed directly from the electronic source. So that's where the providers are touching it, right? Whether they be your PCP, your specialists, hospitals, they are inputting it in, and that's where we close the loop again with the magic word of interoperability. They put the data in, and you have access to consume it. We now have digital versions of measures like breast cancer screening, which is very important in the Medicare and the Medicaid space, and even measures like colorectal cancer screening that are reported for Medicare and commercial, but many states are requiring plans to submit this for the Medicaid population as well. There are nearly 11 digital quality measures now, and this number is going to keep growing.
All right, so here's where the rubber meets the road. How does validation come into play with all of this?
Well, when it comes to reporting performance metrics, if they are not validated, they are not reliable. Now, keep in mind, validation does not have to be external or does not necessarily have to be a regulatory requirement. There must be sound internal processes to ensure that the data reflect the services that were provided to the population. It is critical to make sure that the correct eligible population was included. You've appropriately identified the denominator and the numerator, and to make sure that the rate is reliable, can be used for comparison and benchmarking. So with new data sources, there's going to be an increased level of scrutiny to ensure that the data are truly reflective of the services that were provided and that the data has been validated against the source. I like to take a step back. I like to use the word validation. It seems gentler somehow than the word audit. Though we know that health plans have to undergo many external audits, whether they're required by CMS or the state. And that's why we are here to partner with our clients to help them navigate this space for digital quality measures and aggregated data to ensure accuracy for what they need to do.
Yeah, no, and thank you for stressing the word validation over audit. So I can already see where folks are saying, my organization, currently is not ready to report digital quality measures or ECDS. Why do I need to hear more about this?
So first, I would emphasize that the time is now to have quality improvement and process improvement strategies in place to embrace this change that is coming, because it is not a question of if, but when. When we meet next, I'd like to touch upon the value of aggregated data and interoperability in the context of measures such as follow-up after hospitalization for mental illness and other similar class of follow-up measures. There's also the new measure, as an example, KED, which is the kidney health evaluation for patients with diabetes. It is an administrative measure, and it has a requirement for 2 separate tests. And we'll discuss how measure reporting can be positively impacted with these new data-rich streams that are going to become available thanks to aggregated data and interoperability.
Yeah, well, we'll certainly have to talk about again on that topic.
I'll be there.
All right, great. Well, more to come with our next session and more of building on the context of the series. We're going to touch on a little bit of the elephant in the room, and I think Maria alluded to it, but in episode 5, we're going to discuss a little bit around the measurement burden and the impact and why this is important and what are those trade-offs. So thank you for joining us today. Please make sure you like and share today's video on LinkedIn, as well as subscribing to our YouTube channel under Kaiser Healthcare Solutions. So thank you all, and we'll see you next time.